I want you to really picture a newborn baby in her mother's arms, a healthy baby born at 8 pounds 2 ounces, doing really well, feeding well, her mother's pride and joy. The baby is doing really well until a few weeks later, her mom is a little concerned. She's worried something is wrong with her baby. She talks to her husband, who says, "Don't worry." She talks to her pediatrician, who reassures her and says, "You're a new mom. This is your first child. Everything is okay with your baby. Don't worry." A few months pass, and now mom is completely convinced there is something drastically wrong with her baby. Her baby is not feeding well. Her baby is not growing well. Her baby just doesn't seem to be sucking at the breast as she should be. She's worried. She now goes back to her pediatrician, who also has concerns. Here starts the journey. Her pediatrician does a number of tests. They all come back as normal. The pediatrician is puzzled. Now referrals are made to multiple specialists. More tests, more blood work, more lab work, and the clock is ticking. The baby is getting progressively weaker, but yet no answer. And then a referral is made to a clinical geneticist like myself. I see the baby and I have a strong hunch. I think I know what's going on, yet I have to do some confirmatory testing. I do a chest X-ray, and I do a few blood work tests, including DNA testing and some enzyme testing. A few days later, I have the answer. I now have the difficult task of talking to the family and telling them what the diagnosis is. I do have an answer. That's the only part of the good news here. I tell them that their baby has Pompe disease. The rest of the story is very hard. I've got to deliver this news. Please take your baby home. Enjoy her, because she's not going to live past her first birthday. This is the journey of every baby with Pompe disease until the year 2006. This is my journey as a clinical geneticist, not only for Pompe disease, but for other rare genetic diseases. Delivering the bad news after a long diagnostic odyssey, and then not being able to give any hope other than the bad news that the child is not going to do well or to survive. So what really is Pompe disease? Pompe disease is a genetic disease. It's a muscle disease. It affects about 1 in 40,000 individuals. It's because of an enzyme deficiency, acid alpha-glucosidase. This enzyme is very key in breaking down a complex sugar called glycogen. This glycogen is broken down in a cell of the body called the lysosome. The lysosome is the garbage disposal cells of the body, and lysosomes are everywhere. So when this enzyme is missing in Pompe disease, it affects the heart muscle and the skeletal muscle. So what happens really here is that the heart muscle really thickens to a point where it's unable to even pump any blood, and the baby is really suffering. The muscles weaken, and over time, the baby can barely feed. The baby cannot even smile. The baby cannot move, cannot even breathe on its own, often needs ventilator support. The baby just has the ability to move its distal extremities, and the only thing that we see is a bright-eyed baby who's looking for hope. The hope of life, the gift of life, which we cannot give them because that baby succumbs to the disease. Again, this is the story for Pompe disease, as I said, until 2006. And then in 1991, baby Carmen was born, and we saw baby Carmen at Duke. The same story, we delivered the bad news. And as we returned from the funeral of baby Carmen, the Duke team made a decision. This was not going to repeat itself. And that's where the journey began to find a treatment for this rare disease. How is one going to really treat this disease? We know that there are genetic changes or mutations in the DNA, which then results in a defective or no enzyme. In this case, it is that acid alpha-glucosidase. So the thought is that if we could provide this missing enzyme, just replace that missing enzyme, we could solve the problem. It appears so simple. So why couldn't we have done this earlier? Why were we here and still with no answer? The reason being that delivering this enzyme to the right place, which is in the lysosomes, is not a simple task. It requires a thought process, and it also has to be delivered in a way that's safe, that can go to all the muscles of the body, which we know makes up about 40% of our weight. So this was a 15-year journey, but we did develop a recombinant enzyme by attaching a sugar tag to it, and this recombinant enzyme was then able to go to the right spot, which was the lysosome. And in the preclinical work which we did in birds with Pompe disease who learned to fly, we knew that we had the proof of concept. So now came the next journey, the clinical trials. Here starts the next part. Here's baby Ryan, also with Pompe disease, who died at 9 months of age. At this time, Ryan's mother, Jean, was pregnant. Unfortunately for her, the baby that she was carrying also had a diagnosis of Pompe disease. At that time, the clinical trials had started at Duke, and baby Jason was born. He came to Duke and participated in the first ever clinical trial. That's baby Jason at 9 months. I think you can see he's remarkably different from what his deceased sibling is. The next step then was to do what we call a pivotal trial to get approval from the FDA. This was now with 18 babies from around the world who came to Duke and other centers. And as you can see here, all of them lived past their first birthday. This was remarkable. They were learning to smile, they were learning to sit, they were learning to blow a candle, they were learning to walk, they were learning to run. This information was presented to the Food and Drug Administration, and Pompe disease got a treatment approved, the first ever life-saving treatment, which was called L-glucosidase alpha. This was a victory, not just for Pompe disease, but truly was a victory for all muscle diseases, because this was the chance that we had to now pave the way for other muscle diseases. It also paved the way in another way. Typically, we have drug approvals for adults, and we have a trickle-down effect to our children. Here, it was the babies, and work from the babies that paved the way for broad label approval for Pompe disease. So my journey could have ended here, but yet I did know that a delay in diagnosis is often very expensive for a baby with Pompe disease. A day late is often a day too late in terms of survival or in terms of a baby's ability to walk or not be able to walk with this diagnosis despite this life-saving treatment. So we at Duke then embarked on this journey and nominated Pompe to be part of a process where every baby in the United States could be screened for Pompe disease at birth. It took 7 years, but today Pompe disease is part of the recommended uniform screening panel for babies and is part of newborn screening. There are at least 10 states that have already screened for Pompe disease, and our very own state, North Carolina, will be starting soon. So now comes the next thing. Pompe disease is one of many rare diseases. What is a rare disease? It affects less than 200,000 people worldwide. In some instances, for a particular rare disease, it may affect less than 500 people. There are about 7,000 rare diseases that we know of. And as far as we know, there are at least 25 to 30 million people with a rare disease in the United States alone. So clearly, individually they're rare, but collectively they're not that rare. There's a lot of work to be done. The team that we've assembled at Duke went on and has gone on to develop treatments or be part of the journey for treatments for at least 7 more rare diseases. One of them which comes to mind is a condition called hypophosphatasea. This is a very rare metabolic bone disease. It's often also called soft bones. As the term suggests, the baby's bone is really soft. Even at the time of birth, from the birth canal, there can be fractures, multiple fractures at birth. Changing a baby's diaper is very scary for the parents because they may fracture. If you feel the baby's skull, there's a soft skull because there's no bone there. We've been part of this journey, and now, as I told you earlier, if you understand where the enzyme defect is, you can replace it. And now we have a treatment for hypophosphatasea. This time, the enzyme replacement is targeting the bone, and we have babies now who are doing extremely well. So as I think back on this journey, there's a lot of unfinished work. I have an incredible amount of gratitude to the children and the families that have really paid the ultimate price as we learned as we went along this journey. This picture is baby Jason, the one who was in our first clinical trial. He is today a young adult going to college. He really is my inspiration. He, along with many other children with Pompe disease and with other rare diseases, have been part of this journey, some of which has not been easy, but we've had a success. This has really been possible because of a team and a group of people here at Duke that have worked hard. It's a mission to do better by these children and give them that chance of life. This, of course, is not just my success or my team's success or Duke's success. I think this is our success because without the support from each one of you, I just don't think we would be here today. Thank you.